systems in our society. So today, our system that we are going to be looking at is food and food security. And to do that, we've got a panel who I want to introduce you to. We're rolling.
Melissa, you're going to need to mute yourself then.
Okay. So thank you all for being here. And so first, I'd like to just introduce our panel. Starting us off, we've got Karen Early. So Karen is a registered dietitian, nutritionist, and food advocate. And throughout her career, she's been passionate about sustainable eating, local food systems, and their benefits to the health of all individuals and the environment. Her work with the UW-Madison Extension FoodWise addresses food security, local food systems, food access, equity, and nutrition education. She addresses local initiatives for improving food security in low-income populations through community partnerships and collaborations. Thank you, Karen, for being here.
Thank you, Katie.
Amanda Chu is also joining us, and she currently lives in the east side of Green Bay with her family. That includes her partner and 3 kids. And she's been the organic farm manager of the state Sustainable Food and Ag program at Northeast Wisconsin Technical College for 5 years. Yay, NWTC. Amanda's passion for environmental wellness led her to land stewardship through farming. After farming and managing farms in rural and urban settings, domestically and internationally over the past 12 years, she's become deeply involved in the systems level work to support family farms and natural resources. This includes serving on boards like New Leaf Foods, the Farmery, Slow Farmers Co-op, and the Brown County Board of Supervisors. She's excited about the ways her work with NEW Food Forum gets to the heart of strengthening our food systems in Northeast Wisconsin. With a personal ethic is to be inclusive and normalize diverse thinking of peoples and systems, Amanda leverages the challenges and deficits in the current food system into more collaborative planning with all regional stakeholders. Thanks, Amanda, for being here.
Thanks, Katie. That was a mouthful. I guess we could have cut out the last part.
It's great. And we also have Andrea Hugenvik. Andrea joined YWCA Greater Green Bay in April 2020 as a social justice program specialist. She brings with her a range of experience in higher education, workforce development, nonprofit management, and teaching and presenting. She uses her background in psychology and neuroscience to bring developmental programming for people at any place on their anti-racism journey. She's a qualified administrator of the Intercultural Developmental Inventory, and Andrea coaches individuals and groups in understanding their current relationship with diversity and how to develop skills and attitudes that are richer and more inclusive. She has earned bachelor's degrees in psychology and political science and a master's in sustainable systems. So for self-care, Andrea also likes to knit. She consumes a lot of sci-fi, and she also has a husky that she follows around. So that is our panel today. Thank you, Andrea, for joining us in this role. Normally, she is our host. And again, my name is Katie Truly. I am an academic advisor at NWTC, and I'm also on the board of directors of the YWCA, and I chair the Community Services Committee, which is who brings you this session today. So we're going to jump in. Lots of introductions. Thank you, everyone, for attending. The first question, which is on everyone's mind, is when we're talking about food and food insecurity, what is food security? What is food insecurity? And maybe doing some level setting with that. And I know, Karen, you were going to help start us off with some of that.
Yeah, do you see the screen okay?
We got it.
Okay. Yeah, so it's really easy to use the terms interchangeably, food security and food insecurity. So just to kind of set the table, when we talk about food insecurity, food insecure households don't have the food they need or are uncertain they'll be able to get the food they need due to lack of money or other resources. So what is food security? That's when we have access to enough healthy, affordable, culturally appropriate food for a healthy lifestyle at all times. Kind of a mouthful, but it includes a lot of different concepts, that we're going to talk about. So what we see in terms of food security and food insecurity, when we look at Wisconsin and the US, you can see that Wisconsin children tend to be more food insecure, with 19.5% of children being food insecure compared to the US. But Adults and seniors fare a little better in Wisconsin than they do in the US. And because we're talking about racism, we want to mention very importantly that there's a racial and ethnic disparity when we talk about food security, just as there are with other social conditions. So here you can see that in Wisconsin, the white population tends to be less food insecure, and the Latino population is more food insecure, and the Black population is most food insecure. And this is a trend map of what was happening before COVID. We were continuing to improve rates of food insecurity. Okay, it was food insecurity was dropping. Okay, and when COVID onset, we saw a change, which was contrary to what was anticipated. This downward curve was anticipated that it would continue to decline. So I want to just step back a minute and say the way that we measure food security and food insecurity is an annual measurement that's attached to the census. It's a 16-question survey that puts the questions in context of whether there was enough, whether people could afford enough food. So a question might be, the children were not eating because we just couldn't afford enough food. In the past year, was this often, seldom, or never true? So it's also within the last year. So what we've seen with COVID is we don't have a year, we don't have an annual measurement. So we have a census pulse. And that's kind of changing about the frequency, but it's every couple of weeks. I believe it's an online survey, and it's just a quick 2-question survey. And it talks about food hardships of food insufficiency and child food scarcity in the past 7 days. Okay. So it might say, in the past 7 days, which best describes the food eaten in your household? Enough of the kinds of foods, but not always the kind, or sometimes not enough to eat, or often not enough to eat. So the measurement is useful, but we have to be careful about how we correlate food insecurity with food hardships. Okay, so when we look at food hardships now in Wisconsin, we have 3 different measurements here. Reduced desirability, we tend to not want to use so much because it's not asked within the context of having enough money. Okay, it can include whether you have the kinds of foods you want. Okay, so we tend to want to look at household food scarcity and child food scarcity. And when we do that, and we compare food scarcity from pre-pandemic levels to pandemic levels, you can see that we have an exponential increase in child food scarcity. And when we look at disparities then with race and ethnicity, we see the same thing here. And once again, we see that the African American population has a higher degree of food hardship, with household food scarcity and child food scarcity, followed by the Hispanic population, and then the white population. Feeding America also has their information of COVID impact on food insecurity. Now, they do say projected rate of food insecurity here because we can't say food insecurity yet. So they're comparing 2018 to projected rates in 2020, changing from 11.2 million children now at 18 million, and adults 37.2 to 54. And when you break that down into race and ethnicity, you'll see once again there are great disparities amongst the population. And again, this is a projected rate of household food insecurity because it's just for this period of time. So this is my edit, but it's really important, you know, that we keep that difference. Okay, I guess we'll kind of get into that part later. So that's the background. I hope that's helpful for the context that we want to talk about.
Yeah, no, that's absolutely helpful. Thank you for that. So first, I just want to kind of thank you for sharing that data, Karen, because I think that that helps. I want to give Amanda or Andreas an opportunity to talk too. When both of you are all coming from different lenses, maybe different access points from your work. When you think about food security, the economics of it, social aspect, what are things that you see come up within your work when it comes to food security or food insecurity? You know, however we want to discuss that. Anything you'd like to add?
I want to echo, like, just being grateful for Karen to draw the distinction between the two of security and food insecurity and food security. In, you know, a question that I think probably comes up for a lot of us participating in the conversation is like, why? Like, how did it get to this point? And if the pandemic is exacerbating these trends that we've seen for a long time, why is it even that way? And unfortunate for me, I've not participated in all the Stand Against Racism series, but I'm sure that there's a touch on the history involved that creates these systems that along racial lines that creates disparities. And this is how we see it as it relates to food security and insecurity. So I just want to hearken that there's a long history of, you know, you mentioned economic security and insecurity related to food, and, you know, the entire foundation of the US and why it became a popular territory and instead of colony, and all of that was because of the economic viability of the farming land. And then we needed people to work that land. And so there were enslaved peoples coming to work that land. And, you know, for 400 years later, we're still, that was 400 years. And now years later, you know, we're still grappling with the policies that reinforced that model of economic development based in agriculture. And that echoes throughout the agricultural system. So I spend more time with producers, and, you know, as producers, predominantly white on the landscape in Wisconsin, you know, I just spent a weekend with Farmers Union on a virtual convention, and we're both wrestling with the challenges that farmers face today and thinking about racial injustices of the past, and just whose land is this, and trying to grapple with all of those things. And so it's so blended in all of these different areas of food production and security.
Mm-hmm.
Yeah.
Absolutely.
Yeah, I mean, like other social inequities, food security is also correlated to all the topics that have been talked about previously. And so we can't go without talking about the wealth gap and the ability to accumulate wealth when we're talking about farmland. I mean, farmland is expensive, you know, so you have to be able to buy farmland. But we know that accumulating wealth helps us with home ownership, and that there's a gap in racial disparity there, and then we have pay gaps, you know, between races and genders. And when you have a lower income, then you eat cheaper processed foods in order to have enough money to pay the bills. It's just what people do. And then because of the way a lot of our processed foods are made, they are what we call obesogenic, high in fat, sugar, and salt, and they actually can affect our hormones that affect the brain, the leptin and the dopamine levels that regulate our hunger. So we then start affecting health disparities due to obesity, you know, and weight. And then, there's other disparities like incarceration. We have racial inequities with incarceration, and we know it's very difficult when you come back to reacclimate, and establish yourself economically. So economic access is, one, I guess, the first thing that we wanted to shed some light on.
Karen, can you pull up your slide again about food insecurity versus security? I just want to tease this out a little bit more. So we talk about this piece of food insecurity. So there's these different kind of pieces of this, right? We talk about access. Oh, back to the.
Sorry.
No, you're okay. There we go. So we talk about access. So it's about having enough healthy, affordable, culturally appropriate foods, right? So we're really looking at some different pieces of this. One is, can you actually afford enough calories to keep you and your family from not dying, right? Like that's the first piece of this. The second piece is, do you actually have like physical access to food? One thing that we see a ton of disparities in within our food system is what we call food deserts, which is if people can actually get to a grocery store from where they live. And we see huge disparities in neighborhoods that are more Black and brown neighborhoods. And if you have questions or if you want some kind of pieces about that, the housing disparity webinar that we did earlier in the year is available. I recommend you go and watch that one to kind of think about how our housing has been really segregated over generations of time. But we really see food deserts, which means you have to have a car to get to a grocery store, is really what a food desert sort of boils down to. If you don't have a car, you're not going to have sort of access, physical access to be able to get to food. And then the next piece of that is about this culturally appropriate piece of, can you find foods that are in line with your cultural or religious heritage? Can you find kosher or halal foods if you need those? Can you find the kinds of foods like, we have lots of different populations who are more likely to not be able to eat certain foods because of genetic reasons. So for example, about 75% of Indigenous or First Nations people here in North America lack the enzyme to be able to digest dairy. We just can't eat dairy. So do you have access to things that are, to be able to put in your coffee in the morning that aren't going to make your tummy upset? Can you get to those kinds of foods? Can you get to rice or wild rice? For those of us who are part of Indigenous communities here in Wisconsin, Minnesota, Northern Michigan, wild rice is a huge part of that. Do you have access to those kinds of foods, or can you just not find them? So there's these different kind of layers that we're talking about within food security. Can you just get enough calories? That's the first question, right? But then can you actually get to the food is the second question. Even if you have all of the money in the world, can you actually get to a grocery store? And then at the grocery stores that you have available to you, can you find the kinds of foods that are culturally appropriate for you and that are going to actually work for your body so you can have your own healthy lifestyle? So there's these different kind of layers to this problem that we see coming out in different kinds of ways, and we see different disparities in those layers as well. So Karen mentioned wealth gap, pay gap, all of these different kinds of pieces that create disparities with people being able to actually purchase calories. That's a problem, and there are disparities there. There's also disparities in food access and food deserts. We see food deserts are much more likely to be in places in neighborhoods that are Black and brown neighborhoods. And then culturally appropriate foods, right? We see a lot of grocery stores here in Wisconsin. I'm thinking about my neighborhood. The only place that I could reasonably get to buy food without a car from where I live, where I am right now. It doesn't have any kosher or halal foods. It doesn't have dairy-free options for things. The only kind of rice that's available would be like parboiled minute rice, which our Native communities are not going to think is rice at all. So being able to think about those different kinds of layers and the different kinds of disparities that are involved in each one of those different layers.
I would just one thing on the word. Thank you, Andrea. Just the notion of food desert. I've after reading Leah Penniman and some other writers, consider thinking about it as like food apartheid in a bigger way. And so that's like in the physical access, which is so important for getting food, like physically getting food, but also in terms of like the accessibility points along the entire food system and along the entire value chain of what food is in community. And something that I like about that term food apartheid is that that's created, like that's an intentional political and social weaponization of systems against people, that it's been really intentional, as opposed to food desert, which is like something that occurs naturally. And that's not the case for what's happened, you know, with why we're dealing with these disparities. It's been an intentional structure. There's been intentional structure around this all along the way that's created this lack of access. So I thought that was fascinating when I was reading about that and thinking about that more deeply.
And if I can add another term, we're talking more about food swamps now than food deserts, because there might be some food access, okay, but not to the kind of food that we want. So we call it a food swamp. So if there's not a grocery store where there's a selection of all kinds of foods with healthy choices, we have convenience stores, okay? And we go into, you know, we know what the food is more expensive and the choice is very limited, and, you know, there'll be a whole aisle of chips, you know, and snacks sort of food. But that is where some people do their grocery shopping, because transportation is also an issue. I mean, you will notice that the majority of, in all metropolitan areas, the majority of supermarkets are on the periphery of the town. So you need to have a car to go there, or you take a bus. And buses usually go there, but it takes a while and it's pretty inconvenient, and you have to plan, and you have to bring maybe your children with you, and you have to haul the groceries back, and you have to meet the schedule to be there. So there are all these other conditions as well. And Andrea, I wanted to comment something when you were talking about cultural foods. You know, it's not coincidence that as immigrants come to the country, that you start seeing ethnic grocery stores. Well, you know, they need to have food security. They need to have the foods that are part of their culture, part of their heritage, that have built their traditions, you know, that keep them a community. And so, you know, we've seen that in Green Bay over the years. You just do. You need to have the foods that you are familiar with. I mean, if I couldn't have the foods that I'm used to eating, my body wouldn't feel good, my mind wouldn't feel good, my soul wouldn't feel good. You know, it affects all parts of our being.
As I'm listening to you all, and as the resident non-expert, I'm really fascinated by this conversation. And, you know, as you're talking about that, highlighting that idea that food security is affordable, culturally appropriate access. And as we're thinking about the pandemic, we already were seeing that there was some inequity, right? But that it's now gotten to be even more so. So I'm just curious, as we're thinking about, you know, you had made a tie, I think all of you in some ways had also made a tie to historical economic, the economics of our society, and how economic access does interact or does play into racial and ethnic groups. And I'm just curious from a standpoint of economic access to culturally appropriate foods, plus we're talking about where people live. What are thoughts on, you know, maybe where the pandemic has really, like we said, exacerbated some of this, and what maybe, you know, how are we addressing things like that right now, both in the immediate, but also what other concerns do you have, just even about healthy food or culturally appropriate food, and, you know, how do we realign maybe? That's
like a whole bunch of things that you
a whole bunch of things, isn't it though?
A whole bunch of things. But I do want to say something that's really intriguing. Okay. And that is one of our safety nets to prevent food insecurity is our federal safety net programs. You know, our feeding, our lunch program for schools and senior programs for and food share programs. The amount of food share dollars that are out and available now have more than doubled during COVID. Okay, and we would rather people can shop at the grocery store than using pantries when they need it, because then it's more culturally accessible. Okay, so some people are saying, why are we seeing this big increase in food hardship? Okay, when people have more dollars to buy food. So I want to say, you know, one thing about that is the measurements are based on perceptions. Okay, so it's all qualitative, and you know, when people are undergoing stress and food is a comfort, I mean, your perception of your food scarcity might be greater than it actually is in some situations. Because I mean, I know that, you know, the use of pantries has fluctuated, and, you know, people will say, you know, I've got a lot of food stored at my house now, you know, and some pantries report that there's quite a few less people using the pantry. Well, probably because they're getting more food share. Now, in other areas, that might not be the case. Okay, that's, you know, in Green Bay, we kind of see that as a situation. But if people are concerned about getting out and they're not driving to the grocery store as often, okay, or they can't take public transportation because getting on the bus is kind of freaky sitting next to somebody else, okay. So, you know, there are all these other things that we have to keep in mind. It's, you know, food insecurity is always measured in terms of whether you have enough money, but in COVID, there are also other layers that, you know, we have to consider. And so fixing it doesn't mean throwing more food at people all the time. It does mean giving people healthier food, because just as we've talked about, you know, health disparities among people who are in poverty are 2 to 3 times, the diet-related health disparities are 2 to 3 times greater in food insecure populations. So all the more reason to have healthy food, right? And what we're seeing now with COVID is that there is an increase in obesity, and we're expecting to see the research come out that it's affected disproportionately by race and ethnicity as well.
Gotcha.
And yeah, we can, you know,
Yeah,
talk
so not just just is there food, but again, quality of food is another.
It's so important. And, you know, COVID was really a grand opportunity. Okay. If we had national and local food policy that really established guidelines for what we want as our communities and our nation for health and food access and food quality, then we would have a roadmap. Okay. We didn't have a roadmap. So everybody was like, food, we just got to give people food. Okay. And food is not food.
Right.
You know?
Yeah. So getting at that physical and cultural access piece, it's not just any food.
No, not right. We need a long-term plan that's focused where health is the solution, and what are all the components of health, you know. And we had a great opportunity, you know, when we were going to give people all this extra food to give people healthier food. But when we work from an emergency reaction, all of that is not
right
established.
Is something that I hope we dig into a little bit more later. I know that like getting to the solutions portion, you know, it'd be great to have that time for that. And it seems like
we're headed there, I think.
Yeah,
I think we can
are.
turn that corner. What do you think, guys?
Yeah,
let's turn
I
that
mean,
corner.
yeah, well, and just even maybe this can serve as an umbrella, or I just offer another way to think about that as we throw out some different ways we can come together to work on solutions, is that historically folks of color and those who have been most oppressed and marginalized along racial lines, with regards to food security and insecurity, have not been at the table to make decisions about the direction of things. And so we talk about, I've heard criticism of, well, you get all this money, why aren't you healthier? Why aren't we seeing your health outcomes change? You can get your Whole Foods now. Like, why are we still feeling the burden of your unhealth? And it's just, there's first of all, there's so much there, anyone coming with that perspective to make that sort of criticism, but it's common, and I hear it locally and I hear it at a national level. And there's just so much more. If there are constraints, social, political, economic constraints that have this multiplying effect on people's lives and people of color's lives, it's a huge reach to ask, to expect that communities, folks, individuals, families are going to like just make themselves some hearty chicken noodle soup with a side of healthy salad greens in the way that, maybe more white centered and Euro centered thinkers expect them to. And so there's a huge disconnect with even developing the plans to develop solutions, just like it's been predominantly white led with good intentions. But if we don't acknowledge that, then we're going to be really hard pressed to have a really inclusive, well vetted plan to start addressing these bigger issues. So I'm ready to turn the corner. I just want
Yeah,
to
no, I
throw
think
that
that
out
that's
there.
great. And thank you for that. I think that that's a great segue because I think the question is, what do we do? So we know that it's, we're, to use a food metaphor, we're in the soup of things right now, right? There's a lot of varying parts of the system that are impacting the success or the lack of success in terms of access to food. And culturally, there's a lot of different components that are coming into play. And so, what does it look like to move forward as a community, in Green Bay or in Wisconsin or even, nationally? So one thing I wanted to circle back to first is just even looking at food production, because I'm wondering, like, where does food come from and who's part of that? You mentioned, Amanda, the who gets included in making those choices, and where does our food come from? I think, to me, food comes from the grocery store, and I don't think beyond that. But again, I'm coming from a white-centric, Eurocentric kind of perspective. And that's where I come from. But what, from a food production standpoint, what might that look like? And how could looking even at the whole system of food maybe be impacted from a solutions-based standpoint?
Um,
Big question.
yeah, let me just figure that out real quick.
Yeah.
We
So
we would love to develop and implement that plan.
Yeah, right.
Right.
Getting to
So
that
so
point.
what do we mean by food production? Let's just start with that basic level of,
Yeah,
what
okay.
is, like, who's included and what do we mean by food production? Let's start there.
Yeah, I think well, I'll throw some like of the stakeholders involved in production and see if that makes sense for everyone attending. So like the farmers on the land, and the farm workers who are usually not considered as, we're making production plans or land use policy, protections and things like that. We maybe talk about farm workers when we talk about labor broadly, but not in terms of like having rights and having sovereignty and agency over their own lives and livelihoods. And so that's been historically a big missing piece, but as farm workers are a really critical component, like internationally, nationally for us, and especially in Wisconsin, being heavy dairy, and like other like row cropping, cash crop sort of productions. And then I think we can also think of food producers as those value added processors. Like we need meat processors. We have a shortage of local processors that will that can butcher poultry and hog and beef cattle, which is a real problem. And that's a part of the producer end. But then also like people making pickles, people making granola and using local product or not local product, like all of those I would consider on the production end of things. And so each of those groups of stakeholders in the food production end of things have their own interests, and they have their own goals, and creating the spaces which is what we tried to do at New Food Forum, where all of these different entities and groups can come together and find those common goals that are going to serve all of the interests. And if maybe it's like, oh, maybe that interest of mine is not as important as this interest that's going to benefit the entire system. So what can we do to align to support the system? Because I am a part of the system and I need to figure out how I can protect, support, and build a more resilient and inclusive system. So that's
yeah.
I think
So almost
production
it's such a big system, and it's easy to kind of lose sight of the individuals or the people that are part of that system. It sounds like it's hard to so inequities, when we think of a system, and this happens in many, we forget that there's individual lives that are being impacted by these systems.
Yes, I mean, folks who are especially burdened by the current model for how food works in our society, that is a daily struggle. They're up against this. Farmers are like up to in debt over their heads. They can't quit what they're doing. To bring it back to centering around race, like that's not even a position that so many people of color can even like try to figure out if that's because it's like land access and like rekindling ancient ancestral like knowledge and heritage, like understandings of farming for themselves and maybe that are culturally appropriate for them. Like that's even a barrier. Folks can't even get there. So there are like multiple issues with the problem, just even on the production end of things.
Right.
About food production, I guess just a comment about how we produce what we do produce. We know that if everyone consumed as many fruits and vegetables as is recommended for good health, that there would not be enough produced here. Okay?
Yeah, thanks, Karen.
And that's because of what our government subsidies pay for. Okay, we don't subsidize production of fruits and vegetables. When we subsidize certain crops, they become less expensive to consume. So because we don't subsidize fruits and vegetables, they cost more, which make them less accessible for people who don't earn a fair wage or who are living in poverty. So to kind of bring it back there. Would you like me to kind of share, I mean, when we look at food insecurity and building food security, there is a model.
Let's look at that.
That we look at.
And while you're bringing that up, I am going to just let the audience know, if you do have a question in the Q&A, if you want us to tease anything out, please feel free to ask that question. I also, for those of you that might be joining us on Facebook, I'll try and keep an eye on the comments there, but so yeah, please feel free to ask questions and I'll keep an eye on those boxes. So, yeah, go ahead.
Karen, can I just touch on food production for a second?
Yeah,
before we
for
move
sure.
into this? So a couple of the big places where systemic racism and racial disparities really come in within food production. Amanda touched on this with land access and really who is able to access land to farm, who is able to even be a farmer, because you need land to be able to be a farmer. We see here in Wisconsin, we have a lot of generational farms where farms are passed down from generation to generation. So it's really hard for people who 50 years ago either didn't exist in this country or weren't able to own property in this country to have that same kind of generational passing of farmland. And then we also see the kind of wealth gaps around owning property. And again, if you go back to that housing webinar that we did that's up on our webpage, you can kind of see that and tease out some of those pieces about wealth gaps. Another place that we see a huge disparity is within the really kind of hard, dirty, gross jobs within food production. And we see some really significant racial gaps there. And we see really significant lack of worker protections there as well. And this has really come out during COVID. This is one that COVID has really shown some light on. We've had significant outbreaks on dairy farms that are particularly staffed by mostly undocumented or their documentation status is sort of in question in some way. People from Central and South America who are really terrified to be able to really advocate for their own safety at work because they are concerned about their sort of legal status here in the country in some way. So we've seen some pretty significant COVID outbreaks there that people just aren't able to advocate for their own safety. The same thing with meat packing plants. And that was a huge problem in Brown County. In the real spikes that we saw in Brown County around COVID-19 and meat packing plants, that again, people weren't able to advocate for their own safety in a global pandemic because of their immigration status. Or oftentimes tied up with their immigration status. And then we saw these huge outbreaks, which disproportionately affect people of color and also have huge impacts on the community as a whole and how we're able to really manage a global pandemic when we have these kinds of issues. So that's two sort of big pieces of the food production system where these really systemic pieces and disparities really come into play.
Andrea, those are really critical and important points. So, thanks for sharing those. Our food service workers were considered essential workers too. So not only were they working closely, but they, had to go to work to keep their jobs.
Yep. With very little protection in place,
Right.
oftentimes, or protections that came too late.
And it does make me think, so the previous, a previous Stand Against Racism series that focused on COVID-19 and our Latinx, our Hispanic community really dove into that too, about access to healthcare or trust in the healthcare system. And so we see, again, the reason I bring that up, just the interplay between all the systems and how it's hard. It's a messy system, but it's our most basic human need is access to food, to nourishment. So as we do think about this, and we can certainly go and explore kind of more solutions based, we've definitely named some, problems, issues, maybe some brokenness in our system. What does it look like to have a system that would work? And you all might have different opinions on what needs to be fixed or addressed first, but what are some thoughts? And, as a viewer, what are ways too that we can help as just as somebody who may not be an expert in this field? So let's start with what does a system look like that could work or should work, or that model? So Karen, do you want to bring that back up?
Oops. Okay, so this is 4 legs of food security. It doesn't go into the production end of things, but we talk about 4 things: good jobs, and an income and a safety net along with affordable housing. So people need to have the opportunity for economic security, just as the food security questionnaire always puts things in context of whether you had enough money. Second is a robust federal nutrition programs like food share, school meals, WIC, senior meal programs. So we do have that federal safety net. A third is accessible and affordable retail food outlets and opportunities to grow food. So we've talked about those: food deserts, food swamps, farms, access to healthy, affordable food. That would be farmers markets, whether we can have EBT at farmers markets, community gardens, and then a strong emergency food system. So there's accessible food pantries that provide appealing, healthy, culturally appropriate food without stigma. And pantries, often are supplied by donations, and they can't have all culturally appropriate food, for everyone at all pantries. And so there are, challenges there. So what happened in COVID is that we had temporary fixes, for economic security. We had unemployment insurance. We had eviction cutoff moratoriums, business loans. For federal programs, the school models changed. So they didn't go to school, but they could pick it up, and the quality was not what we were used to because the regulations were downscaled. We had pandemic EBT, temporary food share. It was easier to get access to food share, to apply for food share. We talked about the supply chains for the healthy, for access, to food and how it changed in the grocery stores. But grocery stores also offered expanded delivery and carry out services, so that changed. And then emergency, the government has issued an increase in the commodities that were available. There were new food sources, and safety programs really ramped up. So we have these 4 things where we need to have economic security, federal programs, access, and emergency food to prevent household food insecurity, okay? That's not talking about national food insecurity or what all, some of the other components, that we talked about. So, moving forward, it's about multiple levels. It's about, there's not one level, there's not one community. It's local, state, national levers for change and multiple players, with everyone being in on the plan, together, from schools and nonprofits to, policymakers.
Mm-hmm.
Yeah.
Can I ask one question? Because a question that came up in the Q&A is, what have other communities done that's been successful, and is that where this model comes from? So maybe you can explain a little bit where the model comes from, and are we alone in this, or are there other places where we could look to as examples?
Well, for preventing this food insecurity that is measured by the Food Insecurity Households Survey, this is kind of how we look at it, okay? But I think what's happening nationally is people are looking at food policy, nationally and internationally, because as we said before, we need to have a roadmap here, and our roadmap can't be established by profit, it needs to be mapped out by health, and economics, as well. So just a few approaches, once again, it's jobs. People have jobs, they can buy their own food. But then when we talk about food production, we need to have land access and farmers that are paid a fair wage, and their connections to the markets. And then again, access and land for anyone who wants to grow it, and food literacy, that's huge, okay? Because we have a couple generations now who have grown up on processed boxed foods. And so the knowledge on what to do with foods and prepare it so that you are food secure when maybe you just have fresh foods. What, maybe our processing plants, aren't able to continue for some reason, and we're distributing, fresh foods. Well, we need to know what to do with them, right? So having emergency preparedness plans. And then, as I said, food policy, and we can talk a little bit more about that. But, in terms of local strategies, it's looking at where are your food deserts and your food swamps, making sure you have grocery stores so that everyone has access to that. Looking at farmers markets, is everyone welcome there? And that means, can people use food share cards? Can people use cash? Is there a variety of different kinds of produce there? So,
Yeah,
yeah.
that's wonderful. This idea of food sovereignty, I know that this is an area that Amanda wanted to really touch on a little bit, and so want to have this moment. Maybe we want to just dive into this a little bit and explain why this is important.
Yeah, thanks. I appreciate that, Karen. Karen and I get to circle around in other professional spaces. So I appreciate that we have so much shared language and idea over how we're moving forward to address some of these things here in Wisconsin. So food sovereignty, it has to do with agency and being able to define your own food and agriculture systems. And so in all the little ways and then the big structural ways. So be able to define those things for yourselves as communities, as cultural communities, and things like that. That's when we're talking about food sovereignty, that's what that relates to. And so right now, as the system is, there's no space for that. It happens in little small groups on parallel tracks, but it's not really linked to the more conventional systems for accessing food, producing food, and distributing and redistributing for charitable food pathways. And so food sovereignty has not been woven into the core model for how we're delivering food. In so many of these things, the solutions that we're talking about, they're to address this immediate and urgent needs we have for health and to address insecurity, food insecurity, and a lot of that insecurity we see is, disproportionately impacting folks of color. And then there's like this whole, what for anybody who has capacity, because this is a lot to hold, to try to just take care of neighbors and brothers and sisters in this, and then to get to the root of where this issue is. And I think that Karen signaled at that with discussing policy, like bigger structural changes, bigger economic changes, and it might take a really slow shift in an entirely new economic model. And that's like big, huge stuff. But it's hard to find like that many communities because we're not like isolated. Like Wisconsin's not insulated from Minnesota. Like we function in a regional economy and we depend on each other for different sorts of products. A lot of the systems are really similar. So we can like view different states or cities doing interesting things that are addressing the ripe problems of the moment in interesting ways, but they're not insulated from how the bigger system is still really oppressive to folks of color with regards to food and other aspects of society. So it's hard to find those, like, who's doing this really successfully. We all have to rise up together.
Wonderful. I want to just one question. I think you kind of touched on this. There was a question in the Q&A. Do the local Hmong people experience less food insecurity than other BIPOC people because of access to community gardens and traditional knowledge of farming? So I don't know if anybody has a succinct answer to that or any comments there, but I thought I'd ask it.
Well, I can share. I have done benchmark food security research in collaboration with the University Professional Social Work Department. We haven't done that for, I guess, 6 years now. But our first survey in 1999 actually showed the Hmong population was the most food insecure. So we worked on a lot of initiatives with establishing market gardens, which helped people have a place to produce their own food. And that's actually, then we needed a place to sell it. And we started a market, which ended up becoming the Broadway market, because there needed to be more places for people to sell food. Now the population has, I mean, they have a system also for taking care of their own. And they are landowners. We still rent small plots through the establishment of the Brown County Community Gardens, but they're more landowners and do produce their food. So I'm sorry, I don't have current data on that, but I would say that the Hmong population has done a beautiful job of integrating into establishing themselves, and at least in our county. And I would not think that they are any more food insecure at this point. It's from my observations and people that I know. Hope that answers a little bit.
Yeah, that helps. Okay,
so as people, it just demonstrates, as people accumulate wealth and are able to own land, okay, that it affects the whole cascade.
Yeah.
Mm-hmm.
Very, yeah. So I want to know that we've got about 2 minutes left. So that time went fast. What else do we want to talk about? Any last thoughts?
I guess I just want to be sure that when we talk about food insecurity, it doesn't mean we're talking about hunger. And oftentimes those terms are used interchangeably. And at least in Brown County, I mean, we have enough food, for people. Some areas might not be that way. But it's hunger is a term that touches the heart and is thrown around, kind of casually. And I think there are different approaches for addressing hunger than there are food insecurity. Okay. And addressing food insecurity is where we're at. And it's a long-term, systemic change, based on, yeah.
Absolutely.
For me, I think my last thoughts is just that everyone out there watching, like, hello, wherever you are, if you consume food, you are part of the food system. And, you may be like Katie, who thinks that like your role in this is like you go to the grocery store, which is, it's totally fine if that's your role in this. But I would just really encourage you to think about sort of the choices that you're making and how you're participating in this system, and what all of those kinds of moving pieces are, which there's a ton of moving pieces that go into getting to the grocery store and getting your food to the grocery store. But to start really thinking about what those choices are, and how you are part of this system, and how you really want to participate in this system instead of just being a passive person that has to eat.
Absolutely. Well, thank you. And I saw, Amanda, you said last words to Andrea. So yes. Well, thank you. Thank you, all of you, for being here.
Extend an invitation to be part of New Food Forum as we're working to develop local food policy.
Absolutely. Absolutely. And we can add that to the Facebook. So all of these sessions, like for those of you that don't know, they are also posted on the YWCA Facebook page, and we can even post an invitation underneath this session, an invitation to that New Food Forum. Absolutely. Absolutely. Thank you all for your expertise. Thank you for your time. Attendees, thank you for joining us and listening, and we appreciate your time, and we hope you join us. Our next session will be February 17th. And also, just a plug, if you want to continue to see sessions like this happening at the YWCA and in the community, I encourage you to visit the YWCA webpage. If you have a few dollars, feel free to support the YWCA and in our fundraising efforts. We are a nonprofit organization, and so everything we do is basically a labor of love of all the people that work there. So we thank you all for being here, and enjoy the rest of your day.
Thank you, Katie. Thank you,
Thank
YWCA.
you all.
Thank you.
Thank you.